So looking out for that too. So that's sort of children in a nutshell. Now there was one other one I had. Yeah. So another thing that I see a lot of, I'm going to talk about adults now. One of the things I see a lot of is with adults, is adults that come in, usually sent in by their sleep partner because they're snoring. And again, make a thorough assessment, because snoring is a noise that's made because either there is something blocking the breathing or there's something moving around more than what it should. So I'm going to look inside the nose and throat, but I always use my nasal telescope in the adults because there's no excuse not to.